Hey guys, Doc Hepps here. So if you've been trying Viagra, it's not working great. Will Cialis work? Will Levitra work? Will a higher dose work? What's the deal? Hey guys, it's Doc Hepps here. So the question is, if you've been using one ED or erectile dysfunction medicine like Viagra, and it's not working that great anymore, will another med work better? What's the deal? So I'm going to talk about these different medicines, how they work. We'll give you some guidance as to what to do if the meds aren't working that well. You've been using Viagra. It's been working great for years, but all of a sudden its efficacy is diminished. And you're wondering, is there anything else out there, any other medicine that might help, or are these medicines all the same? Viagra, also known as sildenafil, Cialis, known as tadalafil, and Levitra, which is known as vardenafil, are all in the same class. They're all known as phosphodiesterase type 5 inhibitors. And basically, they're all the same except for a little bit of a tweak on the molecule. So each have different characteristics, and sometimes one medicine may work a little bit better for a gentleman than the other, but in general, they all have arguably similar efficacy. So if you've been doing Viagra or using Viagra, sildenafil with benefit, but it's not working as well now, the odds aren't that great that you're going to take Cialis and it works that much better. If a gentleman were to come in and tell me, hey, Dave, the medication, the Viagra is not working as well, usually what I would do is obviously do a history and physical exam. I might check a PSA, see what's going on with his prostate, check his testosterone blood work, maybe a PSA blood work, and I'd ask if there are any further stressors in his life. Is there anything else going on? How are his diet? How are his other health issues? Is he on any new medicines that may potentially diminish the efficacy of the Viagra? I'd also like to make sure that he's taking the medicine correctly. So whereas before he may have been able to get away taking Viagra on a full meal, Viagra is designed to be taken on an empty stomach. So I'd ensure that he's taking it about 1 hour prior to activity on an empty stomach. Can you try an alternative? Am I very optimistic that that's going to be extremely effective for him? No, I think they're both in the same category. They work in the same fashion, so-called they have the same mechanism of action. An alternative medicine is unlikely to be much more effective. What can you do to enhance the efficacy of sildenafil or tadalafil, Cialis? So again, you want to optimize your health, exercise, optimize your diet, stay active. You want to try and reduce the other medicines, the antihypertensives, specifically beta blockers that you're on. So you would want to work with your primary care or cardiologist to investigate those options. We want to optimize your testosterone. So potentially if your testosterone is low, that can potentially affect the erectile function as well as your interest or libido. So we as urologists can investigate that further with blood work. There are other options to utilize along with the medications. So some men use something called a vacuum device along with these medicines, and that will help them get better efficacy. There's some question whether something called low intensity shockwave may be beneficial as a supplement to using these medicines and could make potentially poor responders to Viagra or Cialis a better responder. And these two items, the vacuum erection device and low intensity shockwave therapy, are further discussed in some of our other videos. My bottom line and tips and tricks to make Viagra and Cialis as effective as possible. Ensure you're taking them properly. Viagra needs to be taken on an empty stomach about an hour before, whereas Cialis has less stringency on how and when you take it. You want to stay healthy. Make sure you're exercising, eating right, avoiding too much alcohol, and these things can help those medicines be more effective. You want to investigate other medicines that may interact with Viagra or Cialis and try and eliminate or change those blood pressure medicines that may be negatively affecting your erection function. You want to get checked out in terms of your prostate health as well as your testosterone, because that may have a role in your erectile function. And then lastly, you can try some of these other options, such as the vacuum erection device, also known as the VED, and low-intensity shockwave therapy as potential add-ons or adjunctive therapies to the medicines. Beyond that, it's really more invasive. And we'll discuss potentially injection therapy or a penile prosthesis in other videos. I appreciate you guys watching. My name's Doc Hepps. Check out our other videos. I think you'll really enjoy them. Subscribe to our channel. Thanks again.